One key issue is that every few years, mental health rises to the surface and receives attention from governments. But it then is not dropped or discarded, but it gets displaced by other higher priorities. I feel that is a problem for mental health right now. My fellow commissioners and I have had vigorous conversations about how best to report back on these issues. In the end, we decided that our credibility and usefulness to the community relies on us telling it as it is. Many of the recommendations we made last year relate to systemic reform that, of course, we know takes time. But we need to make a start. We are impatient for action on behalf of millions of people and families we know are tired of struggling on. This year's report card shines a light on the lives of the most disadvantaged people. It recognises that people with mental illness in prisons and ex-prisoners, young people in juvenile justice systems, and people struggling with mental illness and drug and alcohol difficulties are having an especially tough time. A lack of early intervention cements their disadvantage, while discrimination adds to their exclusion from society. For example, 1 in 7 people with a mental health difficulty also lives with a substance use disorder. Yet estimates show that only 7% of these 340,000 Australians will receive treatment for both problems in some combined fashion. We're also concerned about how we as a society criminalise people who live with a mental health difficulty. We believe each stage of the justice system needs significant reform. Our work has shown that there is a cycle of vulnerability that crosses generations, and vulnerability and mental health are intricately weaved together. Our current system is not designed with the needs of people and families at their core. And these, as I've said, are needs that are far wider than just health services. Early intervention and the need to invest in children and families and across people's lifespans is another theme that runs through the report card. We believe it takes courage to knock on a door asking for help. We must make sure that whatever door is knocked on, there is someone behind it who can see a person's potential and lead them to the right support, care and treatment so that they are empowered to live a contributing life. Tackling the causes rather than the symptoms, preventing illness and suicide in the first place, promoting good mental health for everyone, timely support for when things start to get tough is the best economic and social renewal strategy that we can invest in.
The essence of what we're saying is there should be no wrong door, because in our systems, our hospitals and our health services, we're becoming so specialised that when you get the double whammy, the triple whammy, we don't want to see you. You get to the bottom of the queue. We should be emphasising better integration across those systems, no wrong door, and giving a much greater boost to what Alan was speaking about, which is care right out there in the community, where people don't get divided up into little bits and pieces.
The federal government is particularly proud of the work that the Commission's doing. We're very pleased to accept the report today. We know that it comes with a heavy burden, and I hope that with your support and with the support of the Commission, ultimately we may be able to deliver better outcomes in the 21st century that our country should be achieving.
I'll start with what I should be shocked about, but sadly I'm not, and that's that the 10 recommendations from last year still remain virtually unaddressed.
We don't know how many people are being restrained around Australia, why they're being restrained, or what we're actually doing about stopping the restraint in Australia. The Commission is working very hard with a lot of other people, including the nurses from around Australia, unions. Everybody is trying to work hard on this issue, but we do definitely need to get more data around seclusion and especially restraint.
I think the main thing from this year's report card is the fact that we're starting to see governments and others responsible for acting in the mental health space held accountable. We had recommendations 12 months ago, and we see in this report card that progress has just been too slow on too many fronts, and that largely comes down to the Australian government and state and territory governments sitting down together to really make progress on these important issues.
Importantly, at the end of 2013, we have a new national government. So today's report card is extremely important. It engages the new government, and specifically it says to the new government, we need support. It says to the wider community, there is still a lot of work to do. Last year's report set an agenda. This year's report says, now let's get on with the work.
I particularly was impressed with what Alan Fells had to say today about this is an area that's needing a lot of leadership, and the Mental Health Commission, I think, is playing a really critical role in leading the debate about what we need to do around mental health reform in Australia.
Having all the consumer and carers here is really important. I think one thing I particularly love about the Commission is that it's not all these experts talking about mental health and issues. We actually have people there, so it's real, and people are intelligent and telling us about their needs.
So for me, contributing life is being able to do what everybody else is able to do as well. To walk in the sunshine, to be part of a beautiful community like this, to be accepted in my community, and also to have a job that I look forward to going to.
So I think for me, a contributing life really means a life supported by lots of other people.
So for me, part of a contributing life in the workplace is the creation of workplaces where someone who does suffer from a mental illness or cares for someone who has a mental health challenge can bring their whole self into that workplace and know that they'll be honoured and respected as any other employee.
Well, a contributing life gives the opportunity for people to express themselves and live effectively. What we've seen in the past is a lot of people with mental illness just labelled as having a mental illness, and then that's an excuse for everybody, and sometimes including themselves, to live a second-rate life. But if people have good housing, a purpose, a reason to get out of bed in the morning, some friends, then they can feel like they are contributing to life. And that's what we all want to do.
What I want you to know is that you can make a difference to someone's life. You can say hello. You can make them feel welcome in your community, and it doesn't have to be something really, really special.